Doc, for the veneers, a lot of people they ask that question too, and they need to know about it. Which one better, shave the teeth or not shave it?
That is the most common question that we really get, okay? Because everybody comes in and in their mind that, you know, a veneer, we're not touching the tooth. We're not prepping the tooth. We're not shaving the tooth, okay? The reality is the amount of cases that we can do those veneers without shaving the teeth is maybe 10 to 20%.
How can implants change a person's smile?
You have to keep in mind that your teeth, okay, there is a part of them that's sitting inside your jaw, right? So the implant replaces that root that sits inside the jaw, and it allows us to put teeth on top and give you the smile. The focus is more on getting them to function, and the cosmetic outcome is just a secondary kind of benefit.
Hey guys, on today's episode Beyond the Chair is gonna be with Dr. Mustapha Hotait, one of the specialist dentist doctor. Welcome to the channel, Doc.
Hey bud, how you doing?
Amazing, amazing. Can you explain to us, like, what made you to get to that field?
Well, I come from a family of dentists. My father is a dentist, my uncle is a dentist. So I was around it from a very young age. And to me, I really enjoyed the transformations that happened in front of me. And I appreciated how it changed people's lives. And it was kind of a thing that I held on to as I grew up, and kind of pushed me toward that career, and I love it.
Beautiful. Do you graduate in Michigan?
I went to the University of Detroit Mercy. That's where I did my dental school. Yeah.
And I remember you moved to Chicago.
I moved to Chicago. Yes. I lived in Chicago for about 8 years. I had practices in Chicago, and from there I moved to LA, and I have current practice in LA that I go to every other week, and I'm in Royal Oak currently, you know, more of a full-time.
How did you like in Chicago?
It's cold.
Michigan is cold too.
It's cold. It's a different cold. No, honestly, Chicago, I love the city. It's a great city. I enjoyed my time there, and it was just time for a change. And I always wanted to go to the West Coast and experience living there. And I did, and I got it out of my system. And it feels good to come back home, to be honest.
Nothing like Michigan.
Yeah. I love being home, around family, friends. I think that's priceless.
I know about, like, you specialist with implant.
So I'm focused. There's no specialty.
You focus.
Implants, but I focus most of my work on implant reconstructions and full mouth rehabilitation. Basically, this is for patients that either have no teeth, okay, or they have teeth that are not that good to keep.
Okay.
So they come to me and we kind of rebuild them with dental implants from scratch and change their smile.
How can implants change a person's smile? Because you see them before.
So you have to keep in mind that your teeth, okay, there is a part of them that's sitting inside your jaw, right? So the implant replaces that root that sits inside the jaw, and it allows us to put teeth on top and give you the smile. Okay, but the focus is more on getting them to function, and the cosmetic outcome is just a secondary kind of benefit.
Okay.
Because when they lose their teeth, they lose the ability to chew, to eat comfortably, and obviously it creates some psychological, reservations where they're embarrassed, to smile, to take
100%,
pictures
100%.
and all that. So when they come to me, some of them want the smile for the look of it, okay? But for the most part, they really appreciate getting back to eating foods that they like and not having to think about a denture moving around inside their mouth, and being able to taste their food, because that's a big factor. So that's why they come to me.
How long do you usually take the implant process?
Well, it depends on what we're talking about. So if we're talking about you're missing one tooth and we're placing an implant, within 3 months, which is a period that your implant needs to fuse with your jaw, you can have a tooth within 3 months.
Okay. And I have a question that really always in my head.
Yeah.
Like when you need to do implant, some people, they lose bones. And when you need to put bone, it gotta be like a human being or
cadaver, like dead
pork. And what they call it? Not pork.
No, so there is something called xenograft, okay, which is bone that's coming from cows or from pork, okay.
Cows too, you can use the bone?
Yeah. And for the most part in the US, we kind of moved away from that because we're able to use human bone, which is much more closer in DNA to what we have as humans. And in Europe, for example, all they use is xenograft because they don't have the use of allograft, which is the human bone. They don't have that. So they use a lot of the animal products.
What's the most implant you did?
As far as the case goes, honestly, there isn't one case, to be honest with you, because every patient that comes in has a story, okay? And each one of them, their stories are very interesting and unique because they all have different experiences, So when we go through the process and they come in and, by the time they leave, they have a whole brand new smile, it changes them. It changes them because it's not just the smile that we gave them. We gave them confidence.
100%.
You know what I mean? We gave them the ability to go out and smile and not be embarrassed.
I went through that.
So that changes people's lives.
100%.
And it's amazing the day that we do this, and then 6 months later, when because I see them for follow-ups.
Yes.
The way they walk is different. The way they talk is different. You can feel the confidence, and especially like the ones that come in, they're very reserved, very quiet, very, low tone, feel embarrassed, After they go through that change, their true self comes out. You know what I mean? And there's a lot of people that are hiding.
I felt that.
Yeah.
I felt that.
Yeah. There's a lot of people that hide behind that. And once that little thing changes, it changes everything, For example, you have people that have insecurities about, let's say, their nose. They go get their nose done, right? After that, they feel so much better about themselves, right? Because when they look in the mirror, that's the thing they see and they focus on, right? They might be great human beings all around, right? But there's one thing that's holding them back from interacting with other people. And what I do, it's their smile, their teeth, and that's a big part of why I love what I do, because it changes people's lives, truly.
How is dental health connected overall with health?
That's a great question. So we have to agree that the mouth is part of your body, right?
Yes.
For some reason, this is something that we don't think a lot about, okay? But the mouth is like the entryway to your whole body, right? So any infections that live there have access to your bloodstream and can cause infections in your heart, in your bone. And any inflammation generally, okay? And there's a lot of studies that we see that actually talk about the relationship between the inflammation in the mouth and the rest of the body. You know, with diabetes, for example, it's a big one, okay? You know, so we're when we're preaching about oral health, it's not just for the sake of keeping teeth. It's just overall health.
So what is the steps, the makeover for implant?
So it's actually very simple, okay? The technology has advanced so much that we're able to do this within 6 hours.
The implant?
Yeah. So you come in the morning, okay? Usually most of these cases are done while you're asleep. So you come in, you go to sleep, and we go to work. If there's bad teeth, we take them out. If there's infections, we clean it. We place the implants. We close everything up. We take a bunch of scans, and we start working on the teeth. We wake you up, get you recovered during that time, and a couple hours later, we have a set of teeth, your kind of test drive teeth. We put those on, and you go home. It's as simple as that. 6 hours.
Yeah, but isn't it like, let's say you put the implant, you go 4 months, and then you came back, they're gonna put the actually implant.
So that's different. That's different. So let me explain the difference. So if you're going to get a makeover, which we're doing your whole jaw, right?
Okay.
We're able to connect all these implants, okay, with the teeth that we're making. So that protects the implants, okay? But when you have one implant, that implant needs to be solid and fused with the jaw. And that takes about 3 months for that to happen. So we don't tend to put a tooth on it immediately. But when we have like 6 of them and we connect all 6, that creates stability for the implant. So we're able to do that. So that's kind of the difference.
What are implants made of?
So implants are made of titanium, okay, for the most part. And in the recent years, we found out about allergies to titanium. And we had a different product made of zirconia, okay? So right now in the market, you have titanium and zirconia as your options for dental implants.
Who's the best one?
It's not a matter of the best one. It's a matter of what's good for the case. And that's, you know, that's a big conversation.
What are the main, like, let's say, what are the main risk for implant?
Well, nowadays, okay, and from extensive research, we're about 96 to 98% successful when we place an implant, okay? That means that there is very few people where their body won't accept the implant, okay? But if we're talking about a healthy person, about 96 to 98% success rate. Risks involve like any surgery, okay? You might bleed, which we'll control before you leave. You might have pain, which we'll give you medications for. Manage infections because the mouth is full of bacteria. You're on some antibiotics and some mouth rinses to keep that environment clean. You might swell up like any surgery. We ask you to ice, okay? And for the most part, with these makeovers, I think the recovery within a week, okay? You're not, you know, you're not going months or anything like that. Usually, you know, by the end of the first week, everything's back to normal. You're feeling normal, and most patients stop their pain medications.
You make it too easy.
You know,
Like-
it became really easy. It became really easy. It became really easy. If you know what you're doing, it became really easy. Yeah.
You make it seem, okay, just come here, do it, and then go.
I mean, you know, it's when I tell this to people, they don't believe it. But most people that are in this field and with that focus of like implant reconstructions, they'll tell you the same thing. Nowadays, it's easier than it's ever been to do this, and to do this properly, efficiently, safely, with great results.
So let's say one client came, how you deal with people they have little bone?
So in what we do, okay, most patients that are coming to us, they don't have a lot of bone, okay? And obviously depends on your training. These cases tend to become or to be the most severe cases where there's literally no bone in the jaw. So usually we go to the cheekbone, okay, and we place implants in the cheekbone. They're called zygomatic implants, okay, and that allows us to do everything that we need to do and still get the same results. It's a little bit bigger surgery, okay, than just putting regular implants, but that's how we deal with those cases.
And what about a couple of people, they have gum disease? Can they still do implant?
Yeah. So when we're talking about a single implant, okay,
Yeah.
we need to get the gum disease under control first before we place an implant, okay?
Where does that come from?
Gum disease usually comes from bad, bacteria that sat on the teeth for too long, okay? And obviously lack of good care, okay? Brushing, flossing, seeing a hygienist on a regular basis, and some predisposition genetically, okay, in some cases, kind of, makes this problem worse over time. And if you don't catch it, there's really no cure. So we keep it under control. We try to slow down the progress, okay, but you're always at risk of that problem coming back. But as far as like placing an implant, usually if it's a single implant or a couple implants and the rest of the teeth are there but they have gum disease, we have to treat the gum disease first before we place any implants.
Okay, does an implant stop bone loss?
So when you take a tooth out, okay, and you do nothing, the bone shrinks, okay?
Why?
So
I'm always like, it's a bone. How?
yeah, so bone kind of when especially in this area, okay, in your mouth, in your maxilla and your mandible, okay, if you're not using it, you're gonna lose it, okay?
That's crazy.
So what keeps it in place is the fact there is teeth, and those teeth, when they chew, they give signal to the bone that, hey, there is function for you, okay? And there's receptors in the bone that know this, okay? It's amazing how God created us. It's an amazing detail, right? So when you lose that, there is no use, and there is no, we call it load, there's no function that's happening on that jaw. So it tends to kind of shrink over time. And obviously as we age, there's a lot of deficiencies that sometimes we might not be aware of that can, affect, our bone. And that plays into it. But that's usually what happens. It's the loss of teeth.
So you know how our lifestyle, like what kind of health or lifestyle can affect implant?
So diabetes, okay, smoking, gum disease, okay. Those are big ones if they're not controlled, okay. Obviously, patients that are diagnosed with cancer and they're going through some type of chemo or radiation that has some impact on the health of the oral cavity, and those all can have impact on the success and on the longevity of how long those implants will be in there.
Can you explain what all four
All-on-4
implant are?
Yeah. So all-on-4 is a type of procedure, okay? When a patient comes in, okay, and let's say they have hopeless dentition, so the teeth are no good, or they come in with no teeth, okay? What we do is we place implants, okay? We used to call this all on 4, now we call it all on X because we don't want to, be restricted to just 4 implants, okay?
Okay.
And we place these implants in certain areas, okay, to kind of create a base, okay, for the teeth that goes on top, okay, to rebuild the smile. So that's when you hear all on 4, all on 6, teeth in one day, that's what's happening.
Okay.
Is replacing the implants and then putting the teeth on top the same day.
So Doc, a lot of people, they ask that question too, and they need to know about it.
Yeah.
Which one better, to shave for the veneers, to shave the teeth or not shave it?
Okay. That is the most common question that we really get, okay? Because everybody comes in and in their mind that, a veneer, we're not touching the tooth. We're not prepping the tooth. We're not shaving the tooth, okay? The reality is the amount of cases that we can do those veneers without shaving the teeth is maybe 10 to 20% of the cases, okay? The majority, we need to actually prep the teeth. We need to shave the teeth. Now, what we're talking about is 0.3, so 0.3 to 0.5 of a millimeter, okay? So it's a very, very small amount, okay? And again, if you're trained in this, okay, in this aspect, you know that this is actually what makes the case last a long time, is not shaving too much, because that's what gives it the strength to glue it to the tooth. If you shave too much off the teeth, the bond becomes a lot weaker because you're bonding to the internal part of the tooth, and that's not a good area to bond to. We want to bond to that white part of your teeth, the enamel, okay? And that, that's important to understand. Now, you have cases where veneers are not actually a good option because the patient has problems. They clench their teeth, they grind their teeth, they worn them down significantly, okay? So in those patients, sometimes veneers are not a good option.
Really?
Yeah, because they will break them, okay? So that's where we start talking about crowns or onlays. Those are different terms for different things that we do to kind of solve those cases, okay? But that's important to understand. It's case by case, and not everybody's the same. No 2 sets of teeth are the same. No 2 patients are the same. So we treat the patient and the conditions they have, and we plan the case so it's done in the least invasive way, the quickest way, but also a way that's going to make sure that these teeth function properly so they can last a long time.
Wow.
That's critical.
So, because I have one of my friend, they shave his teeth a lot.
Where did he go? Turkey?
Yes.
Yeah.
So he did them there, and when he came back, they look nice. I don't like them because I love how you do it. I'm not saying that fun of you. Sure. And big shout out, Sam Baidoun. I love you. Dr. Sam, I don't know if you know him.
Sam, yeah.
You guys do not straight white.
Yeah.
You know how we blend the zero to dark?
Sure, yeah.
You guys make it from natural, from light white to dark, which looks amazing.
Yeah.
So when he came back, he started eating and all his teeth started what do they call, waja?
Yeah, there's like pain or sensitivity.
Sensitivity, yes.
Yes.
It's crazy pain, from water, not even too cold.
Yeah.
Tea, that's what I'm saying about shaving a lot.
So that's a lot was shaved, okay? And the more you shave, the closer you get to the nerve, right? Mm-hmm. And that creates that inflammation and that sensitivity. And sometimes, and I've seen this, nothing against, the dentists in Turkey. Okay, I've seen some good work from Turkey, and I'm seen some disasters. Okay, the same thing from a lot of the places that people go to just travel, to get healthcare done. Okay, in those types of cases, I always tell the patient, my advice to you, yes, you might be saving on money for the short term, but when your doctor is not next to you when there's a problem, it's difficult for any other doctor to touch you. Okay, it becomes a matter of liability. All right, now we want to help these patients, right? We like to help them from the get-go. The worst thing is to revise after somebody. So let's say your friend comes in to see me, right? He's not happy. I take everything out, okay? I see underneath there is nothing. They shaved everything down to a little nub, okay? I can't do miracles. I can't recreate what was lost, right?
You gotta take it
and
out.
It adds, now we're talking about root canals to make them feel better, get the sensitivity away, you know what I mean? And that causes like issues over time. So yeah, it's not a good idea. And going back to what you're saying, like you love how the look of things are, the natural look.
Yes.
It's very, very subjective, right? There's people that want that 90s Hollywood look, okay? White teeth,
yeah, but
right?
it doesn't look good.
Yeah, it doesn't look good. We moved away from that. That was very popular back in the day. That was very, very popular, okay? We moved to more natural, subtle aesthetics where you look at the patient, you can't tell they had their teeth done. You just know they have nice teeth, and that's the goal.
That's the most important thing, to be honest. I don't want to like smile and after a while, like I seen other my client, he did them in Colombia, I think. Yeah, in Colombia. When he came back, like after I think 2 years, his teeth start turn like the edge of it like kind of black, or not black, but it's not the same. So you can see them. I don't know. Can you clean these, or
so most of the time it's one of two things, okay? It's either the type of crown they put on has metal inside and you're seeing that metal edge, or the tooth itself was that color and it was hidden at some point, but there was some inflammation in the gums and the gum kind of shrunk and now exposes the actual color of the tooth, okay? Which is a little bit darker, right? Nowadays, to kind of, solve this issue for the patients, we don't use any material that has that black metal, okay? And when we treat the patient, we hide those edges just enough under the gum so they don't cause inflammation and still look natural, okay? Because otherwise it creates the inflammation, the bleeding gums, and eventually the gum recedes and then you can see that margin that we hid.
What kind how many kind of different veneers, like usually the
materials?
The materials.
There is different materials, okay, and they all give different type of, like, they have the good and the bad, okay, but there is multiple multiple types that can be used.
Is it these veneers, like the good one, it change over time or no? The colors?
So the color of veneer should never change, okay? It can stain, but that stain can come off, okay?
Like you can clean it.
You can clean it. But if when the veneer was placed, it wasn't sealed properly, so that margin, okay, can stain over time and you can't take that stain off. And that's one of the most common complaints of patients over time, that they see that and they don't know why. It's because it was not sealed properly.
What do you see in the future of implant?
I mean, right now, I think anybody in the dental field can agree it's prime time, okay? We have great technologies, okay, that are out there that help make the procedures more comfortable, help it be a little bit quicker for the patient. What the future hold, there's a lot of, a lot of studies and research out there about different ways of doing things. But I think the biggest couple, couple things is when a patient, let's say, loses a nerve in the tooth and they need a root canal or whatever, we're trying to regenerate that nerve so the tooth doesn't lose its nerve, supply and its blood supply. And we're getting good results with that, actually. Another aspect, we're changing the shapes of the implants that we're using. And with time, we're learning what actually works and what actually causes problems. And with every new design, the implants are becoming more and more predictable. So that's another advancement to look forward to. We're now in the age of lasers. And the lasers that were used 20 years ago compared to the lasers now, the laser is laser, but the frequencies that we're able to use the laser for has changed dramatically. And it's only getting better and better, okay? And it helps, again, it helps us not need to numb the patient in certain, procedures. And it makes it just a lot easier. And also the outcome, it's a lot better. And in some situations, we tend to kind of not need surgical interventions because we're able to use that. So all these are good things that are just changing and getting better with time. And some of the materials that we use, they're only getting better and better. Where things used to ship easy or break easy, now it's much more difficult for that to happen. And again, it's only getting better and better.
100%.
So yeah.
What is guided implant surgery and what's the difference?
Okay. So guided implant surgery means that before we touch the patient, okay, we take a CT scan, okay, and we take an intraoral scan, and we merge them together, and we figure out exactly where we need to place that implant, okay? And then we make a guide, okay, that's going to allow us to do this, okay, and be very, very exact, okay? It removes any kind of margin of error in your placement, okay? And you use that to kind of do your surgery compared to just using your hand, your free hand, and doing the surgery that way. There is some people that love guided surgery. There's some people that hate guided surgery. I'm a person that's, I don't hate it or love it. I'm indifferent.
Now with all the technology, how the scan digital helps with the dentist surgery?
Okay. So digital scanning is actually an amazing technology to have, okay? Because most patients, when they come, they hate taking the impressions, okay? You put all that material, you put a big tray inside their mouth, they're gagging and they're, spitting and, so they hate that, okay? And on top of it, it's, by the time you take that and send it to the lab, there is some small changes that happen in the material. And it's not as accurate, okay? So digital scanning came, and all that stuff became history. So we use the scanner, it's like a little camera. You put it inside the mouth and it just takes pictures, okay? And with those pictures, we build the whole jaw, right? And it takes seconds to do. It's very accurate. And it allows us to send it to the lab very quickly and the lab to get started on things very quickly. So it speeds up also the process, and it also makes it much more comfortable for the patient, and it's very, very accurate.
Beautiful. And other question I'm gonna ask because it happened to me.
Yeah.
You know when you have Invisalign?
Invisalign, yeah.
Okay, so when your teeth start changing,
Yeah.
your tooth become loose.
Okay.
How after you're done with them, they become strong again?
Yeah.
It's crazy.
So it's, again, the body is amazing, right? And this is not just on the teeth. That happens in other areas of your body where there is bone, right? So when we're thinking about the tooth is not sitting in concrete inside your bone, okay? It has these little fibers that connect the tooth to the bone. And these fibers act as suspenders where the tooth can bounce, right? So you put 1,000 pounds of pressure, it can bounce and absorb that without breaking, right?
Really?
Yes. So that's what makes teeth better than implants, is they're able to do that, okay? Now, when we're moving teeth around, okay, and let's say you push in a certain way on a tooth to move it, right? So when we're pushing, okay, whatever is in front of that tooth kind of dissolve for the tooth to move, and whatever is behind it is actually adding bone and strengthening that. So when we stop that pressure, that area that was kind of losing that bone stops and tightens up, and the area behind it tightens up, and everything kind of sits where it needs to be. And that's why teeth kind of get tight and they're not as loose anymore.
Man,
Yeah.
it drives me crazy, to be honest. First, when I start seeing my tooth like
scared.
moving, shit,
No, they're
I'm
not
gonna
supposed
lose
to
them.
move that much, okay? But for the most part, once you're done and they're in that stable position, that's why you get retainers to kind of lock it in
Yeah.
and allow that formation to happen of new bone, new fibers, okay? And that's what gives it stability.
Beautiful. What do you love the most about like implant smile?
What I love the most about what I do is watching my patients change their life afterwards and change who they are as people, and actually letting their true self like come out. That's what I love the most, and it's very like rewarding and very nice to be part of that, and you having a hand in making that. That's actually a great thing.
I always tell Dr. Osama, bro, you kind of like a mechanic too. You gotta measure and fix, and you have all the tools and doing.
Yes.
It's crazy too.
There's a lot of engineering, right? There's a lot of engineering because there's a lot of moving parts we're trying to put together, right? And that's just like building the foundation, right?
Yeah.
And then you go and start thinking about the colors of the teeth, the colors of the gum, the size, the shape, how it fits somebody's face, how they speak, how they eat. Is there enough space for their cheeks? Is there enough space for their tongue? All these factors have to come together when we do this. And when you kind of like keep an eye, and have the experience, you'll have less and less kind of situation where you have somebody that's not happy or they don't like what they see. And for the most part, it's a process that's happening between the patient and the doctor. It's not like I'm going in and like, hey, this is my way and this is how we're doing it. No, it's a conversation, because at the end of the day, when they look in the mirror, they need to see something that they like. And the best way is to involve them in the process. So add to engineer and artist and doctor, you're also working with a lot of, psychology to get the results that you need.
How you usually deal? Let's say I came with no tooth. How do you know what kind of like measurement for my teeth to put on my face?
Yeah. So one of the amazing technologies that we have is a facial scanner. Okay. We're able to scan your face with you smiling with no teeth. Okay. And in the computer software, add teeth, okay, to the size, the shape that you like and that I like, okay, that will give us a result that's functional as well as beautiful, okay. And you know, it made that very easy. Back in the day, we used to have to make, you know, a set of dentures and work off of that, and you still have to, like, you know, deal with all that. Nowadays, we don't do any of that. It's all digitally done.
Is that do you have any patient, you finish his teeth and he said, I don't like it?
I don't have that issue. I've never had that issue. Knock on wood.
God bless.
But never say never, right? But I think big part of it is because how much communication we do. Okay.
Kind of like seeing my barber.
Right, 100%. Like, I come into you, okay, you're an amazing barber, right? But I have a picture in my head of how I want to look. If I don't tell you, how are you going to give me that, you know, amazing cut?
You're right.
You know? So and that's why, like, when I sit in your chair, the first question, what are we doing today? Right? And you walk me through it. You tell me, you know,
100%.
this would look better. This would look better. We shouldn't take, you know, too much off of this. And I trust you, right?
100%.
You know? And that's kind of, you know, what this, I would say, not kind of, it's exactly what we do. Okay. It's just communicate about what you see so I can see the same thing. And from there, like, build what we need to build. And we build it together.
You know, Doc, what I love what I do, and I love what dentists do.
Yeah.
Because we give people confidence.
Confidence, yes. Yes, yes.
And I always tell, not me, one of my client, it's not a client, he's one of my best friend, Tyson, he's Chaldean.
Yeah.
He came, he said, teeth. He come from West Bloomfield. All his boys barbers, but when he come, like, he just talk me and him, you know. I don't call him often. Like, he once in a while, teeth, I want to come see. Like, I book him hour and a half, just a haircut.
Yeah.
He said, I swear to God, when I get a haircut by you, I walk better, I smile better.
Yeah.
I can talk to people better.
Yeah. Like, that's the magic.
Give that feeling. It's amazing.
You know, that's when I'm talking to my patients and I can sense, like, there is lack of confidence, right? I always tell them, like, hey, you know, whatever it is that's holding you back, okay, from expressing who you are, okay, we want to put that aside for a second. Over the next, 2-3 months, we're gonna be on a journey, and this journey, you're gonna see changes, not just in your teeth. You're gonna see changes in who you are as a person. Okay, they look at me and they're like, I don't know about that. Okay, you're crazy. We do what we got to do, and then they go. They see their family. They get one compliment, then another compliment. Then they see their friends. They get another compliment and another compliment. What does that happen? What does that do? It builds your confidence.
100%.
It reassures you that what you're seeing, everybody else is seeing, okay? And as that confidence builds up, you start behaving without fear because there's nothing holding you back anymore.
100%.
Right? And I think that's, like, the reason why people seek treatment. It's for that. Most of them don't really, like, tie it together, as much. And you have people that do. But once everything's said and done, they all come in with a different attitude.
I seen that.
Yeah.
Because we do kind of same. Like I
Yeah,
told
yeah,
you.
100%. I agree.
I love being
Like when I get a cut, I feel good. I feel good. You know, whenever I feel like I'm overdue, I start like not brushing my hair, not, you know, putting a hat on, putting this,
Yep.
putting that. You know what I mean? Like I'm start hiding, right?
Yep.
And then it changes things. So yeah, I appreciate that.
You look good. You feel good.
Yeah, 100%. 100%.
Like I love what I do.
Me too.
I swear to God, every day when I come and cut my client, they feel good. Chief, what do you do?
Right?
Like,
That's a good feeling. You also feel good, right? Yeah, to me, that's like big part.
I give them attitude. Yo, get out of here.
You know, it's a big part of like coming to work, okay, and like being focused on helping people, okay, in whatever capacity that you can. I think that is like once you find the thing that you like to do to help people, you become successful.
100%.
You know, it's not like any other way. It has to be tied into helping people.
100%. You know, Doc, like I have two my clients. I swear to God, they come, Tiff, you know why we feel bad for you? I tell them why. They said you never got a teeth cut.
That's a good one. That's a
Make
good
me
one.
like,
yeah, that's a good
but
one.
I got amazing haircut by Mac. Which,
yeah.
big shout out, Mac.
Big shout out to Mac, yeah.
You keep him crispy. Look at that. As soon as he walked in, I thought, man, that's a Mahmoud haircut.
There's nothing to do. He's awesome.
Doc, I really appreciate you for coming.
Thank you for having me.
It's amazing.
Yeah.
I mean, I love what I do, podcast. Like,
Yeah.
it gives people a lot of information about teeth, about how confident you are after like the problem you have. Because I felt that
Yeah.
when I have two of my teeth missing,
Yeah.
I can't smile. I wasn't confident.
Yeah.
But when I got them done, it's a beautiful feeling. Thank you guys for helping a lot of people, to be honest.
I appreciate it.
And hey guys, make sure if you need any question about teeth, hit up my best friend, I don't want to say client, or Dr. Mustapha.
Thank you.
Or Sam Baidoun. I can't.
Yeah.
Because I love this guy too.
He's
both of them amazing.
Yeah.
Amazing human being, an amazing doctor. I promise you.
Yeah.
You will never regret it.
Yeah.
Peace out.